About 20 years ago, this scary headline appeared in our local newspaper, Floss or Die. I don't know what that was all about. Was it some sort of fear-mongering to try to sell more newspapers? Actually, it turned out that there was some reasonable science in that story. And it was all about how if you have poor dental health, bacteria can get into your bloodstream, can end up in the coronary arteries, and can trigger heart attacks. Very, very good story. And we started flossing. Didn't worry about it at all. And then what happens? Just recently, another study comes out, this time warning us about toxic chemicals that are found in dental floss. Well, take the word toxic, link it to dental floss, that gets our attention. Of course, you have to remember that toxicity is always a question of dose. All right, what are they talking about? Chemicals called PFAS, perfluoroalkyl substances. And these are very interesting chemicals because they resist both water and fatty substances. So they are used in so many consumer items. We use them in fry pans. That's what Teflon is all about. It's a perfluoro substance. And we use them in food containers because the inner lining, which protects the food, is also made of these kind of chemicals. We use them on furniture, on carpets to make them stain resistant. So it isn't a surprise that they end up in our bodies. And some of these chemicals are also found in some dental flosses, the ones that are made with Teflon. So this study was indeed an interesting study, and it is of academic interest. However, must be pointed out that the study said absolutely nothing about any health consequence. All the researchers did in this case, and it was a pretty good study published in a proper peer-reviewed journal, all they did was measure levels of 6 different of these chemicals in the bloodstream. And then they asked about 178 women who were part of this study what they had been using regularly. So were they frying their food in fry pans? Were they eating food from fast food containers? Were they using dental floss? But there was no attempt at quantization. They just asked them if they ever did this or they never did this. So, of course, is already suspect in terms of the numbers that are involved. And then when you look at the data and you find the chemicals that were found, the range is all over the place. For example, with the fry pans, some women who used these fry pans, Teflon fry pans to cook with, had higher levels of PFAS in their blood. Some, believe it or not, had lower levels. Now, it is true that with the dental floss, on average, people had higher levels. Of course, we don't really know that those chemicals were coming from dental floss. They could have been coming from other things, from fry pans, from fast food containers. And the difference between the people who said that they used dental floss and the ones who didn't was very, very small. So there is really no significant issue here. As I said, it is of academic interest because we do want to find out where these substances are getting into our bloodstream, because in high doses they are potentially toxic. We know from cell studies, we know from animal studies, we know from human occupational exposure that we want to be on top of this. So there is a degree of concern. However, this study does not tell us anything about toxicity, about whether or not the chemicals that are found in our bloodstream are enough to worry about. So for those people who ate from fast food containers, for example, okay, some of them had higher levels of PFAS, some had lower levels. And I would suggest anyway that what is in the fast food container is of bigger concern than what is leaching out of the protective lining. And as far as the dental floss goes, well, the evidence is very, very clear that the benefits outweigh any kind of risk, because we know that there is a connection between incidence of various kinds of disease, especially heart disease, and the bacteria that get into our mouth as a result of poor oral health. So what we really want to do is keep flossing, and when you eat out of fast food containers, that's good. Sometimes props come in handy. What you want to make sure is that you floss after, and if you're going to worry about what's in the container, not what is leaching out of the lining. And flossing, do it after every meal. Your body will thank you.